Lungs do not collapse between breaths, and some air always remain in the lungs, which can never be expelled because option A, there is a positive intrapleural pressure. It is incorrect because intrapleural pressure is normally negative rather than positive. Option B, pressure in lungs is higher than the atmospheric pressure. It is also incorrect because this condition occurs during exhalation, but it does not explain why the lungs do not collapse between breaths. Option C, there is a negative pressure in the lungs. It is also incorrect because the lungs themselves do not maintain negative pressure. It is the intrapleural pressure, that is, the pressure in the pleural cavity that surrounds the lung, that is negative, and that helps to keep the lungs inflated. Option D, there is a negative intrapleural pressure pulling at the lung walls. Now, as already stated, the negative pressure in the pleural cavity creates a suction that keeps the lungs expanded and prevents them from collapsing. And this pressure helps to ensure that some air remains in the lungs at all times, preventing their collapse between the breaths. And this negative intrapleural pressure combined with the elasticity of the lungs and the surface tension of the alveoli keeps the lungs inflated and ensures that some air remains in the lungs for always. Hence, it is the correct option.